Hello everybody, welcome back to my channel. Today we're taking a deep dive into Ehlers-Danlos Syndrome, or EDS as it's abbreviated. If someone you know has the diagnosis, or if you're just curious, stick around. We'll take a look at what EDS is, what its symptoms are, and the different types. EDS is a group of connective tissue disorders that affects the body's collagen. Collagen is crucial for maintaining strength and elasticity in our skin, joints, blood vessels, bones, and other connective tissue all throughout the body. Some of the common symptoms of EDS includes joint hypermobility. This means that joints move beyond the normal range of motion, which usually leads to a lot of chronic pain due to instability. The skin is usually described as soft and velvety, a lot of times stretchy, it bruises easily, and it tends to scar easily. These are the two main criteria that a lot of doctors learn about in med school, the joint hypermobility and stretchy skin. There's so many things that are affected in EDS. There's tissue fragility, so easy tearing or injury of the skin and other tissues. Chronic fatigue that can affect daily life. Muscle weakness, particularly in the limbs. There can be a lot of skeletal problems such as scoliosis, joint dislocations, or early onset osteoarthritis. Gastrointestinal issues, there can be problems such as reflux, constipation, diarrhea, or abdominal pain. In the heart, there can be palpitations, tachycardia or POTS, or blood vessel abnormalities, or aortic root dilation in some types. The dental issues, there can be gum disease, dental crowding, or other oral health issues. With your eyes, it can have issues like myopia or other eye conditions. Nerve pain or entrapment are common in EDS. They can cause things like tingling, numbness, and pain due to the nerve being compressed. Now, the symptoms I've listed out there are the most generalized EDS symptoms across the board, but there are 13 different types of EDS. They each come with their own comorbid conditions as well as mortality risks. I'm going to go ahead and list all the 13 types on the screen here for you. So all types of EDS are diagnosable by genetic blood tests, except for the most common. The hypermobile type, or hEDS, as they call it, is estimated to be 90% of all EDS cases. This leaves the vast majority of us not able to use genetic testing, and we have to use the Diagnostic Criteria that was created in 2017, which is a series of physical exams and questions. And that's what we're going to go through next. The first joint that's assessed is if you can push your pinky back like this, past a 90-degree angle. You get 1 point for each hand, so the right and the left. The next thing that is looked at is if you can push your thumb down to your wrist and have it touch. You get 1 point for each hand as well there. The next thing that's looked at is if your arm bends back past where it should. You get 1 point for each arm. And then the legs, you also look to see if the legs bend back farther than they should. You get 1 point for each leg that bends back too far. And then the last item is only a single point. It's if you can bend down with your knees straight and touch your hands palm on the floor. So in case you didn't keep up with the math there, each side of each movement is worth 1 point. So you get right and left for all of the 4 first maneuvers, you get 8 points. The last one, hands reaching down to the floor, is worth 1 point. So that's a total of 9 points in all for the bite and score. So if you have 6 or over and you're a child or an adolescent, you meet the qualifications. If you are between the ages of 18 and 50, you have to have 5. If you are over the age of 50, you only have to have 4. If you meet those qualifications, you can go on to the next criteria set. If you are 1 below that, then you can go through the extra criteria, the extra questions listed below the Beighton score on the form. And if you meet 2 or more of these questions, that can bring you up to your qualifying score. So the questions are, can you now or could you ever place your hands flat on the floor without bending your knees? Can you now or could you ever bend your thumb to touch your forearm? As a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits? As a child or teenager, did your shoulder or kneecap dislocate on more than one occasion? Do you consider yourself double jointed? So next is criterion 2, where 2 or more of the following features, A, B, or C, must be present. So 2 of the 3. So starting with feature A, 5 must be present. First point is unusually soft or velvety skin. I do have that one. Mild skin hyperextensibility. I do have that one as well. I'm going to try to throw a picture up here of that. Unexplained striae. Basically, when you think of that, you want to think of really bad stretch marks, and that is also without a history of significant gain or loss of body weight, because that can also do the same thing, so they want to rule that out. Bilateral pyogenic papules on the heel. I'll see if I can throw a picture of mine up here. I do have that one. Reoccurrent or multiple abdominal hernias. I do not have that one. Atrophic scarring. That's basically a type that's seen in classical EDS. I do not have that one, but you can easily find pictures on Google for that one. Pelvic floor, rectal, or uterine prolapse. I did have a uterine prolapse, so I did qualify on that one. Dental crowding or high or narrow palate. I qualified for that one as well. I did have orthodontia as a kid with expanders because of my narrow palate. Arachnodactyly, and you can use 2 different ways of assessing that. Arachnodactyly basically means long fingers. They term it as like spider fingers, I guess, they look like spiders, which are long and thin. You can assess that using the Walker sign, which I'll show you mine, and the Steinberg sign, which I can do that one as well. So I qualified on that one. The next point is arm span to height ratio greater than 1.05. I qualified on that one as well. The next point is mitral valve prolapse, mild or greater based on strict echo criteria. I did not qualify for that one, thank goodness. And the next one, aortic root dilation with a Z-score of greater than 2. I also did not qualify on that piece. So if you had 5 or more in that section, then feature A, you're positive on. The next feature is feature B. This one's pretty simple. It's if you have a positive family history, 1 or more first-degree relatives independently meeting the criteria for hEDS. I did not qualify on feature B. I do not have any family members that have been diagnosed, though I do have my suspicions on one, but nobody else has been diagnosed, so I was negative on feature B. Feature C, you must have at least 1 of these criteria. The first one, musculoskeletal pain in 2 or more limbs, reoccurring daily for at least 3 months. Chronic widespread pain for greater than 3 months, or reoccurrent joint locations or frank joint instability in the absence of trauma. So I did qualify for feature C because I could easily show my shoulder joint instability as well as in my fingers and some other small joints to my diagnosing doctor. So I met personally feature A and feature C. So I got through criterion 2 because you only need 2 of the 3, A, B, or C. And the last section I'm going to put up here, but I'm just going to kind of sum it up for you a little bit instead of reading through it. The first one basically is trying to exclude out other types of EDS. For example, classic has certain types of scarring, things that with the skin that could indicate that it's another type of EDS that could be genetically tested for. So it's ruling those out. The second point is ruling out autoimmune conditions that can mimic it, such as lupus, rheumatoid arthritis. That can be done with an ANA test, a blood test. I had that and was negative for ANA. The third point is talking about ruling out neuromuscular disorders, thinking the myopathies, as well as other connective tissue disorders such as Louis Dietz, Marfan's, and ruling out skeletal dysplasias such as osteogenesis imperfecta. So these things all can mimic it, but in the end, you just do a rheumatoid arthritis blood test to rule out some of these things, as well as other criteria for connective tissue disorders. So that all gets ruled out, and by exclusion, then you would know that it could only be hEDS. So now that you know some of the symptoms of EDS, along with how to diagnose EDS, hopefully that helps somebody you know, or perhaps you, on your diagnostic journey. If not, you can hopefully give it to your doctor to help guide them as well. In future videos, we hope to go in on some of the comorbid conditions that come along with EDS, because there's lots of them. If you have something you're interested in, please let me know. I'd love to do a video on something that interests you along the lines of EDS, or something you're curious about. If you want to see future videos, please give me the like button, subscribe, and I hope to see you in my next video.